ICU physician Dr. Michael Warner speaking out against the province's handling of the sixth wave of this pandemic. He joins us live now with his thoughts on that. Doctor, thanks so much for your time. A lot of what we're hearing about case numbers is anecdotal. I mean, we have the wastewater data. I'd like to hear from you based on your work experience. What are you seeing in terms of hospitalizations, ICU admissions, and who is presenting themselves to hospital?
So ICU numbers in the province are relatively stable. They increased a bit a few days ago, but there were 10 new patients last night. I think 159 total, which is great. But just looking at my hospital, 8 days ago, we had 2 COVID patients in the hospital. Now we have 17, and that's just one hospital. And if you multiply that over the entire province, you can see that if you have more patients in hospital, even if they're not in the ICU, some of those patients will deteriorate and end up in the ICU. Again, the more COVID patients we have in hospital, even if it's with COVID as opposed to for COVID, the isolation protocols are no different. The bed blocking effect of having a patient with COVID in a bed is no different. And the fact that staff can get sick is no different. So it really is a problem for the healthcare system, the more patients we have in the hospital. Plus, some people will get sick and some will die. So the more death we can avoid, the better. So the fact that the Premier says, we have, in theory, 3,000 ICU beds, which I know we can't staff, doesn't really make sense to me because we want to avoid having people that sick that they need the ICU bed in the first place.
Some of the numbers that we've seen as of late, for example, Tuesday, the case count marked a 38% increase in hospitalizations over a 7-day span. Just yesterday, a 3% increase in the number of people in ICU with COVID-19, just over 27% increase in hospitalizations overall. The messaging that we've heard from the government, both from the health minister as recently as last week and from the province's top doctor the last time we heard from him in front of reporters, was that an increase is expected. Do you think that these numbers reflect what was expected?
I don't know, Jackie, because, why am I talking to you? Why isn't the Chief Medical Officer of Health speaking to the public? I think he last spoke on March 9th. I'm not the person who should be providing Ontarians with information. It should be the government and the Chief Medical Officer of Health. So if wastewater is skyrocketing, what does that mean? How should people adjust their behavior? If parents are seeing that kids are dropping like flies in class and not being able to go to school because they have COVID, what does that mean for their own children? In my view, we need to hear from the Chief Medical Officer of Health today so that people can adjust their behavior if they need to, or be reassured if that's what he thinks the message that he should give is. But we haven't heard anything. And silence is not the way to approach something. Communication is key. At the bedside, when we're dealing with patients, communication is vital. And when you're dealing with a population in the middle of wave 6, communication is just as important.
You talked about capacity a little bit, the number of beds that are available. 27%, I think, of hospital beds or ICU beds remain available to adults anyway. But you say that there's, the staff to care for those patients is not available.
Well, I'll just walk the public through this. So pre-report says 3,000 ICU beds. That's wrong. Okay, so the peak of wave 3, we had 2,100 patients in Ontario's ICUs. 891 of them had COVID. We were moving up to 40 patients a day among hospitals. We had canceled all surgeries that weren't emergent, and staff are redeployed who didn't normally work in the ICU to work in the ICU. So if he's saying that we have 3,000 ICU beds, I don't believe him because it's not true, because people like me and nurses who work with me won't be available to staff those beds. Let's set that aside. I don't think we'll come close to needing that many beds. I think the key is to avoid illness as much as possible and also offer reasonable protection for those in public who are immunocompromised or otherwise medically frail or fragile. And that means for essential activities like going to school, going to the grocery store, getting your drugs to manage the disease that you have, masks should be put back on. I think that's a reasonable compromise for everyone who lives in a free and just society where we have to take care of each other. It's not too much of an encumbrance, especially when there's so much COVID circulating. But I don't think he's going to do it, and more people will get sick because of it, and I think that's wrong.
What is the impact of early therapeutics on those people who do get sick? Is that changing the face of this virus and how it's being treated and its impact on the healthcare system at all?
I think it could. To be able to get Paxlovid, you have to get a test relatively early in your course. I mean, it's really difficult to qualify to get a test period, and then to actually get some of the the supply that the government has distributed. So I think other provinces have rolled Paxlovid to pharmacies. Perhaps Ontario is going to do the same. But I think most people out there don't really know where to get a test, who qualifies. You really have to search on the internet. I don't see the public messaging communicating the way that I think it should be, because early therapeutics could really take the pressure off hospitals if it was widely available and if you could get the test to qualify for early therapeutics in the first place.
Okay, ICU Dr. Michael Warner, thanks so much for joining us on CP24 this morning. Great to have you on.
Thank you.